the Centre for Global Epilepsy is designed to close the diagnostic gap for the 50 million people living with epilepsy around the world.
And we know that majority of the burden is in fact in low and middle income countries.
It's unfortunate that the countries that have got the largest burden of neurological disorders, mind-brain disorders, have got the least capacity to handle these particular conditions in terms of human resource expertise, in terms of facilities and access to care.
Although medicines for epilepsy have been available for a long time and they're not expensive, still many people in many countries don't have access to these medicines.
So people, they go to the hospital, to the health center, they don't find medication, they give up, they don't go back again.
So there is going to be a need to build the capacity of non-specialists, doctors and nurses in primary care to be able to assess, diagnose and treat these conditions.
The Oxford Martin programme has led to several developments, including an epilepsy diagnostic companion app to help primary healthcare workers better diagnose epilepsy, a headset to better record brainwave activity in low to middle income countries, and a global epilepsy research database which we are utilising to capture novel data relating to epilepsy from low to middle income settings. We brought collaborators from around the world to Oxford and to the Oxford Martin School to try and share learning. That has seeded a multitude of collaborations within those colleagues. So people are now working independent of Oxford and developing their new ideas, new technologies, new solutions in global mind-brain health.
A lot of the conditions, movement disorders, epilepsy, tend to be highly stigmatized.
Children are pulled out of school. People are forbidden from getting married.
But when you then talk about it, maybe from a traditional understanding, maybe it's a curse, it's a bewitchment.
We have realized that community engagement and talking to those individuals with lived experiences allows us to direct our energies and resources to those areas that they think are important.
We think the potential impact of this is vast. Not only can we try and better diagnose epilepsy, a terribly stigmatized condition around the world, and then hopefully lead to better treatments for those people with epilepsy, but the technologies and the methodology behind the technologies can also be applied to mind-brain health more broadly. So we would take this technology and look, for example, to what we can do in people who might be affected by stroke, might be affected by dementia, or might be affected by mental health conditions. The Oxford Martin School programme in global epilepsy has been a tremendous journey, and it really has seeded global epilepsy in Oxford. More than that, I really think it has led to a programme of work which shows that we truly can build any world we want as long as we try.